If you or a loved one have been diagnosed with triple-negative breast cancer, you may have questions about the disease and its treatment options. Medifine is here to help. This guide was created by our team of medical professionals to help answer the most common questions about triple-negative breast cancer. As always, please discuss this information with your doctor before making any medical decisions. Triple-negative breast cancer is a subtype of breast cancer. It is a rare malignant breast disease that lacks receptors for the hormones estrogen and progesterone and the human epidermal growth factor protein, also known as HER2, usually found in other breast cancers. Triple-negative breast cancer grows and spreads more quickly, is more likely to reoccur, and has a worse outcome than other breast cancers. Symptoms of triple-negative breast cancer are the same as for other types of breast cancers, for which the most common initial symptom is the discovery of a painless, hard mass with uneven edges, although some breast cancer lumps can be tender or even painful, soft, and round. Additional symptoms of breast cancer may include breast swelling, breast or nipple pain, nipple discharge, nipple or breast skin that is reddened, dry, flaking, or thickened, nipple retraction, orange peel skin, known as dimpling, and swollen lymph nodes, usually under the arm or around the collarbone. The cause of triple-negative breast cancer has been linked to a mutation in the BRCA1 gene. Most breast cancers caused by a BRCA gene mutation are triple-negative and thus lacking the 3 receptors for estrogen, progesterone, and the human HER2 protein. Triple-negative breast cancer accounts for 10 to 15% of all breast cancers and is more common in women under the age of 40 who are African American or Hispanic and who carry the BRCA gene mutation. 70% of breast cancers in individuals with a BRCA gene mutation are triple-negative. Triple-negative breast cancer is classified into 5 stages, some with multiple substages. The precise staging can get complicated, but here is a simple way to think about each stage. Stage 0, the cancer cells are non-invasive and the cells have not spread. Stage 1, the cancer cells are invasive but are barely detectable beyond the original source. Stage 2, the original tumor is small but it has grown, spread, or both, but the spread is still contained. Stage 3, the tumor is growing and spreading, but it has not spread to the bones or other organs. Stage 4, the cancer can be any size, but it has spread beyond the breast and nearby lymph nodes to other organs such as the liver, lung, brain, or bones, or other distant lymph nodes. Since triple-negative breast cancer lacks receptors for the hormones estrogen, progesterone, and the HER2 protein that are present in other breast cancers, this cancer cannot be treated with hormone therapies and HER2 protein receptors administered for other breast cancers. The following are the treatments for triple-negative breast cancer. Lumpectomy is a surgical procedure where the breast lump is removed along with a few lymph nodes to determine whether the cancer has spread. This surgery is usually done for early-stage breast cancer for a small breast lump on an outpatient basis and may be followed with radiation therapy. Mastectomy is a surgical procedure where the affected breast is removed along with nearby lymph nodes to determine whether the cancer has spread. Patients may elect to have a breast reconstruction procedure performed directly following mastectomy during the same surgical session. Radiation therapy usually follows lumpectomy, where high levels of radiation are directed at the affected breast to kill any residual cancer. Radiation therapy for breast cancer is usually administered 4 to 5 days a week for 6 weeks. Chemotherapy is the primary systemic treatment option for triple-negative breast cancer and is administered to kill any cancer cells that may have spread elsewhere in the body, as well as to lower the chances of the cancer reoccurring. While triple-negative breast cancer usually demonstrates a good response to initial chemotherapy, the cancer tends to reoccur. Immunotherapy is a newer approach to cancer treatment that helps the patient's own immune system to kill cancer cells, often by targeting certain proteins that help cancers avoid the immune system response, such as the PD-L1 protein. Clinical research is always ongoing, and new findings are reported regularly. To find the latest clinical trials and treatment advances for triple-negative breast cancer, visit Medifine.com. Patients undergoing treatment for triple-negative breast cancer may experience treatment-related side effects, which depend on the treatment and more commonly include swelling in the arm, nausea and vomiting, skin and nail changes, and loss of hair. Treatment for these and other side effects is an essential part of breast cancer care. While in the past, most triple-negative breast cancers have usually spread rapidly or relapsed and have had an overall poor outcome with patients quickly dying, Today, women diagnosed with this cancer have better outcomes as treatments have improved. However, survival rates for triple-negative breast cancer are based on many factors, such as a patient's age, overall health, the cancer stage, how and where the cancer has spread, response to treatment, and other factors. Complications of triple-negative breast cancer are related to the cancer itself and/or the side effects of treatment. Advanced breast cancer-related complications include pain and the cancer spreading to organs such as the liver, lung, brain, and bones. Breast cancer treatment-related complications can include breast swelling and tenderness, scar tissue, wound infection or bleeding, and swelling of the arm due to the removal of the lymph nodes. Regular mammograms are recommended. Performing regular breast self-exams and noticing any changes while being aware of the signs and symptoms of breast cancer is important for early detection of breast cancer. Individuals with a family history of breast cancer should undergo genetic screening for the BRCA1 or BRCA2 gene mutations. Medifine exists to help you find better care faster. In addition to the information provided in this guide, you can also find top experts, second opinions, clinical trials, and latest medical advances specifically for triple-negative breast cancer at Medifine.com. To your health.